Good evening, Manny. Well, it's a game changer for a number of reasons. One is the cost. This Oxford University AstraZeneca vaccine costs about $5 Australian versus closer to $25 for example, the Pfizer vaccine. But perhaps one of the biggest differences is its ease of transportability, really, the fact that it's so robust. It doesn't require, unlike the Pfizer vaccine, those freezing -70-degree temperatures. It doesn't need specialist fridges and refrigeration. So that means it can be rolled out to places like doctors' surgeries, care homes, and in the weeks to come, we're likely to see it being introduced in much bigger vaccination hubs, things like sports stadiums and exhibition halls. So that's really important for the UK. But then when you look at it from a global perspective, it's even more important because it means that developing nations in particular will have access to this vaccine in areas where those sort of refrigeration logistics simply aren't possible, and that will be vital for suppressing the virus globally. And this Oxford-AstraZeneca vaccine, a significant proportion of it will be made available to the developing world. In fact, AstraZeneca says that it will be providing about 1 billion doses on a not-for-profit basis. So this vaccine, it's just a raft of a range of vaccines on offer, but from a global perspective, probably one of the most important.
And just among those other vaccines, how effective is this one compared to the others?
So the results, the peer-reviewed analysis of the results shows that this Oxford-AstraZeneca vaccine is about 70% effective on average. Some information coming from the trials suggested that with certain dosages, it may be up to 90% effective, but it is 70% effective officially, safe and effective. Compared to some of the others, the Moderna and the Pfizer vaccines, they're closer to 94, 95% effective, but 70% is certainly still better than nothing. And when you consider the ease of rollout, it's really important. Another important fact about this is that it doesn't need a follow-up vaccine quite as soon as, for example, the Pfizer one. So under the Pfizer regime, you are meant to get a booster after 3 weeks. Regulators here say that you can get a Oxford vaccine booster about 12 weeks later. And that is really important because it means that more people here in the UK and around the world will be able to get their first dose of it sooner. And we know that after the first dose, there is a degree of protection offered. So that's really important.
Now, the UK and London in particular is suffering through a surge in cases with hospitals under tremendous strain. Is the country ready to roll out this vaccine?
Look, the government here says it's ready, and indeed some vaccination hubs are already in place. We're seeing mass vaccination programs already taking place in the hospitals here and in some GP surgeries and gradually getting into care homes. But this new Oxford vaccine will change things completely because it is so easily transportable. We're likely to see much larger venues used for this kind of thing. The government says that it'll be hundreds of thousands in the first week. What the government really would like to see, and what everyone would like to see, is millions of people being vaccinated every week. But at the moment, the infrastructure simply isn't in place. But the army and an army of volunteers as well is being prepared and trained to start giving these jabs over the next few weeks.
Nick Dole, thanks very much.
Thanks, mate.